Good evening, Ron. Thanks so much for all of your help tonight, and good evening to each and every one of you. We have hit our capacity tonight. We are now just over 1,000 on our North Bay Coronavirus Town Hall. Tonight, we're going to have a special focus on Marin and Sonoma counties. Again, my name is Mike McGuire, and I'm honored to work with you as state senator here in the North Bay. The most important part of tonight is going to be hearing from each and every one of you. We're going to spend as much time possible answering your questions in real time. Email us now, senator.mcguire@senate.ca.gov. Emily, our producer, is standing by right now, senator.mcguire@senate.ca.gov. Email us your questions, your comments. We're going to get to as many possible tonight. And I got to say, we have an outstanding panel joining us this evening. And before we get into our town hall, I'd like to be able to make a few brief remarks. To say that we're living in challenging times, well, it would be an understatement. So many in our communities are struggling to stay healthy, and tens of thousands in Sonoma and Marin counties have lost their jobs due to the economic downturn related to the virus. Look, we have faced amazing struggles before in this country, and I have no doubt, despite the challenging road ahead, we will persevere. And tonight, we're going to give you straight talk from the medical professionals on the front lines combating this virus. This virus is tenacious, and as much as I hate to say this, it's very likely that this pattern of ebb and flow is going to continue for at least another 12 months. And that's why we wanted to be able to come together this evening, to be able to answer your questions and be able to respond to your comments. We'll cover subjects such as, why are the virus numbers in Marin and Sonoma County? Why have we recently seen recent surges? What are the main drivers behind those surges? We'll be talking to the doctors about their concerns looking ahead to fall and winter. We'll cover the coronavirus overlapping with the flu season and how we can all be better prepared. We'll provide an update on San Quentin and, of course, our local schools. And where exactly are we at with the vaccine, and when will it might be available? We have the experts to help answer all of your questions. Again, email us, senator.mcguire@senate.ca.gov. We're grateful that we have Dr. Mays. She's the Public Health Officer for Sonoma County on with us tonight. Coming to us live from Marin, we have Dr. Willis. He's the Public Health Officer for the County of Marin. And, of course, we have one of the best infectious disease doctors in the Golden State. It's Dr. Brewer from UCLA Medicine. All right, let's get right into our town hall. We're going to start with Dr. Brewer, again, from UCLA School of Medicine. He's a fantastic infectious disease doctor. He's going to provide a prediction for what will look like with the coronavirus in the fall, the winter. He's going to cover when we're actually going to realistically see a potential vaccine. He's going to talk about, are we seeing any changes in the virus since it was first discovered in California? And, of course, he'll kick us off with an overall update right here in the state with the coronavirus. Let's get into it. Dr. Brewer, welcome back. The floor is yours.
Thank you very much, Senator McGuire. Thank you also to everyone who's joining us tonight. So, as you know, over the last several weeks, we've had a resurgence of SARS-CoV-2, the virus that causes COVID-19 across the United States. It started to pick up in mid-June through mid-July and was centered particularly in Florida, Arizona, Texas, and unfortunately, California. And so right now, we've had about 4.7 million cases in the United States, and we're still averaging about 60,000 new cases a day. Now, that's down a little bit from mid-July, so hopefully start of turning things around again, but still, we're having sustained community transmission across the country. We've had, as you probably heard, over 150,000 deaths across the United States, and we're still having about 1,000 people a day die across the entire United States. Here in California, we're up around 525,000 cases. You may have heard in the news that there have been some troubles with the data for the state, so take those numbers with a little bit of grain of salt, and about 9,700 deaths. we have approximately 5,000 new cases a day and about 200 deaths. In terms of the demographics, as we've talked about before, the Latino, Latinx population in particular has been hit very hard. They account for about 58% of all our cases, and they only make up about 39% of the population. In terms of mortality, it's really our elderly that are bearing the brunt of this infection, with about 75% of all the deaths in the state occurring in individuals over the age of 65. In terms of where the virus is spreading right now, I can give you good data from Los Angeles County. About 60% of all cases are occurring in individuals between the ages of 18 and 50, and the case rate is almost 3,000 per 100,000 in individuals between the ages of 18 and 29. So it's young adults that are driving this infection right now in California, and that's just something we need to be aware of. In terms of vaccines and where we stand, as of the end of July, the World Health Organization had identified 26 vaccine candidates in various stages of human trials, and another 139 vaccine candidates that were in preclinical development, meaning they're still in the lab, have not yet been tried in humans. We have 3 vaccines that are going into efficacy trials this summer. That means that they've already had trials to show that they can generate an immune response in people, not just animals, and that these vaccines do seem to be safe. And now the question is, do they actually work? So those trials will be starting in July for the Moderna vaccine, in August for the University of Oxford vaccine, and in September for the Pfizer vaccine. What the U.S. government is doing to try to rapidly get vaccines available is they're actually producing these vaccines before we have the efficacy results. That's a very unusual step. It's called Operation Warp Speed, where they're essentially buying the vaccine before we even know if it works. The goal is to have vaccine available by October, with the hope that there will be 300 million doses by January of 2021. Whether the vaccine will actually work or not, though, we'll have to wait to see. In terms of what to expect for the winter, all respiratory viruses transmit more in the cold weather, particularly as people move indoors. So it is likely that we will see more COVID-19 in the fall and the winter than we will over the summer. The good news is, at least so far, looking in the southern hemisphere, it has not been a bad influenza season, probably because a lot of the things that we do to prevent the transmission of SARS-CoV-2 also work to prevent the transmission of influenza viruses. So hopefully we will not have a bad flu season on top of the COVID-19 pandemic as it occurs. But do remember, get your influenza vaccine this year. So even if you haven't done that in the past, this is the year to get your influenza vaccine. Try to help to protect you and the community and everyone around us. And I'll be delighted to answer questions over the course of the town hall.
Dr. Brewer, thank you so much. That's Dr. Brewer from UCLA Geffen School of Medicine. We're taking your questions and comments, dozens coming in every minute. Senator.McGuire at senate.ca.gov. Good advice, Dr. Brewer. Get your flu shot early. Let's now get a full briefing from the public health officer in Marin County. His name is Dr. Willis. We want to appreciate him and say thank you for your incredible work over these past many months. Dr. Willis is going to give us a full report on all issues of the coronavirus in the county of Marin. The floor is yours, Dr. Willis.
Thank you, Senator McGuire. Good evening, everyone, and thank you, Dr. Brewer. Since you ended with the appeal to get a flu shot, I'll start with that. I think that's just one of the key points that I think we all have control over some of this, and there's obviously high risk as we come into the wintertime. We'll be battling, two major viruses at the same time, and one we will not have a vaccine for, likely and when we will. And it's important that everyone this year more than others go ahead and get that flu shot. So my update for Marin in terms of the numbers, we've got 2,978 cases so far accumulated. We're going to cross that 3,000 case limit tomorrow, most likely. We've had 106 total hospitalized in Marin County. 21 of our residents are currently in the hospital. 5 are in ICUs. That number of hospitalizations has been stable for the past 2 weeks after a rapid increase in hospitalization rates in mid-June that Dr. Brewer referred to. We've performed 53,505 tests. So about 1 in 5 Marin County residents have been tested for COVID-19. We've had 55 deaths so far. 94% of those deaths are among people age 65 or greater, and 70% of those deaths are among people greater than age 80. So by far the most important driver of mortality for COVID-19 in Marin County is that 45 of those deaths are residents of long-term care facilities. We've had outbreaks in multiple facilities over the past 2 months. Right now, there are 6 facilities in Marin County that are seeing activity in that long-term care environment, which is one of our strategic priorities. The age group with the greatest number of cases is people aged 19 to 34, followed by those aged 35 to 49. So the patterns that Dr. Brewer referred to across the state of California are also present in Marin with the shift towards younger patients. 75% of our cases are people who identify as Latinx, which is only actually 16% of our population. So that is right now the main driver of total cases is our essential workers who have been on the backbone of our workforce from the start, and household transmission related to those workers bringing it back and passing it within densely populated housing. Hospitals are still right now mostly below capacity. They are prepared. They are not currently stressed by COVID-19 and do have adequate PPE. That's our 3 hospitals, Marin Health, Kaiser, and Southern Novato. Flu surges happen annually in our hospitals, usually starting in November, December. Many people don't realize that sometimes our ICUs in our hospitals are actually at capacity or above capacity just for influenza. And so, obviously, as we're concerned about surges in COVID-19, we already know that our systems are seasonally stressed with influenza, and we're concerned about people who would be co-infected with both, obviously because they would be more ill, but also independent, incidents of influenza and COVID-19 is a real risk for us in terms of surge, and another reason why it's so important for us to get the flu vaccine this year. Finally, San Quentin outbreak, we're now 2 months in. It began in early June. It is resolving after 2,212 cases total among the 3,500 inmates. So the majority of inmates in that tragic outbreak were infected. 106 were hospitalized cumulatively, with 22 deaths. Right now there's about 12 of those inmates who are still outside of the facility in hospitals. Most have been returned to a field hospital that has been established at the prison. The outbreak is being managed by a state disaster response team, an incident command team that was brought on site partly with the support of the senator and other elected officials who helped advocate for the response that was necessary to that complex and wide outbreak. We are focusing our efforts in San Quentin on testing and isolating those positive inmates from other inmates, making sure that the people who are infected on site get the health care that they need in the field hospital, and then applying the lessons learned from that outbreak to prevent this from happening ever again in that really constrained and challenging setting of a mass incarceration setting where people are not free to be socially distant. And that concludes my report.
Hey, Dr. Willis, thank you so much. We're grateful. That's Dr. Willis. He's the public health officer in the county of Marin. We're going to hear more from Dr. Willis in just a few moments. We got your questions and answers coming in fast and furious. But first, let's hear from the public health officer from the county of Sonoma. Her name is Dr. Mays. She is working 24/7 on the betterment of all residents in the county. Dr. Mays, the floor is yours. We welcome you for your report.
Great. Thank you so much. I really appreciate the updates from Dr. Brewer and from Dr. Willis. So in Sonoma County, we are really seeing similar things from the rest of the state of California. As of August 4th, we had 3,208 confirmed cases, 1,547 active, 1,619 recovered, and we have, unfortunately, seen an increase in deaths. Now we have 42 deaths, with 3 more deaths reported in the past 2 days. We've done slightly upwards of 75,000 coronavirus tests at this time. So if you take a look at our data, we're still seeing a really sad and terrible disparity in the Latinx population. About 51% of our cases now are occurring in those persons who describe themselves as Hispanic or Latino, whereas about 17% are happening in the white non-Hispanic population. But that, because of the difference in population, really means like a 9-fold increase in cases among the Latinx population, and we're doing a lot to address that we can get into if there are questions about that. I also want to state that, like in Marin, we're seeing a real blip in cases in younger individuals. In fact, 38% of our cases are occurring in those aged 25 to 44, since we had started opening up a couple months ago. And then we have 13% in 18 to 24, 13% in 45 to 54, and so on and so forth. But not as many cases in our older population over age 65. However, the majority of hospitalizations are among adults over 50, and 35% were ever in the ICU, and we did have 17 hospitalized patients that passed away. And I think, just as Dr. Willard said in Marin, we're really seeing the devastating consequences of COVID in persons in skilled nursing facilities and residential care facilities for the elderly. As we know, these are the most vulnerable populations that are most impacted by COVID. 35 of the 42 deaths to date are associated with skilled nursing or residential care facility persons. And we have a total, actually, of 448 cases so far in this group. About a third of them are occurring in staff members, but the majority are in residents, with 325 cases in skilled nursing facilities and 123 in board and care homes. I also wanted to state that over time, as we've opened, we have been looking at our data to see where our cases are coming from. And we have seen a lot more cases of community transmission. In other words, persons who get COVID and we don't really know where it came from. We now have, of the past 1,140 cases that we evaluated, 70% are still happening in close contact, big households, worksite outbreaks. But we have 15% of our cases occurring in community-acquired persons, that is, community-acquired settings, 6% in travel. So we're seeing more cases associated as people move from county to county in our state. And I think something really important to underline is that we're seeing a lot of cases occurring in people who have attended gatherings. We looked very closely at our gatherings. Anywhere from 13 to 15% of cases at any given time are occurring with people who got together with family and friends. Maybe it's extended family, maybe with neighbors. But the important thing is that we need to stress that it's important to only really do things with household members at this time. We're seeing cases in small friend family gatherings like barbecues, dinners, holiday gatherings like the 4th of July and Father's Day, large residential parties, funerals, camping groups, things like that. So I really think I want to stress that moving forward, that would be one of the main things that we would stress in public health, is to really try to avoid gatherings to the extent that you can. And I want to also underline the importance for the influenza vaccine.
We have about 30 seconds.
And we do have a vaccine for influenza, so please do ensure that everybody gets vaccinated. And we're looking forward, hopefully, over the next few months, we'll probably see an increase in cases, increase in outbreaks, and we're looking forward to that vaccine because that'll be the turning point. Thank you.
Thank you so much, Dr. Mays. That's the hard-working public health officer from the County of Sonoma. That's Dr. Mays. We appreciate you being with us tonight. All right, it's the most important part of this town hall. It's getting to your questions and your comments, and you have responded with many questions coming in. So let's get right to it. First question, we're getting a lot of folks asking, how is this virus spreading? So we just heard from Dr. Mays in the county of Sonoma. It's spreading from social events, everything from in social gatherings, from birthdays and holiday celebrations and backyard barbecues, as well as funerals. Dr. Willis, 30 to 60 seconds. How is it spreading in the county of Marin? Where do you think the biggest spread is? Is it social gatherings as well?
Yeah, we've got three main drivers. The first is, as I mentioned, is essential workers who are, our Latinx community primarily. Tends to be a younger workforce out in the community, have been since the beginning of the shelter in place, being exposed, having transmission sometimes within the workplace or on the way to the workplace in carpools, and then also in the community level where they live, where there's obviously much more densely populated housing there and 5 to 10 people living in one unit where we see lots of transmission there. The second is skilled nursing facilities, residential care facilities for the elderly, seeing clusters in those settings. And then the third is, lamentably, is sort of, people behaving badly, frankly. It's, gatherings, sleepovers, parties, indoor parties where, we've been clear that that's not safe to engage in yet. It's actually not allowed under the order and is against the law. And obviously, I think many of us are missing our friends and feeling like this has been going on for a long time and maybe getting a little bit too relaxed. But our contact tracers do find that is one of the additional sources of infections in Marin is through preventable gatherings.
That's Dr. Willis. He's the public health officer in Marin County. So three main drivers for the recent surge. It's those who don't have a choice to work. The vast majority are Latinx, essential workers, convalescent facilities, as well as social gatherings. We're now going to go to Dr. Brewer, infectious disease doctor from UCLA. Dr. Brewer, two questions. We're going to ask for a lightning response. This is coming in from Robert. Is it possible to contract COVID-19 through the eyes?
So, Robert, it is. You have mucous membranes on your conjunctiva, so basically around the eyeball, and the virus can get into the body through any mucous membrane, so your eye, your nose, your mouth.
Thank you so much. Appreciate that. So let's go to our second question. This question is from Lloyd. Dr. Brewer, we get a lot of, the science has been going back and forth as far as surfaces, hard surfaces like countertops and doorknobs to groceries. What's the latest thinking on contracting the coronavirus from groceries, countertops, doorknobs? Give us that answer, Dr. Brewer.
So from groceries, probably essentially zero, Lloyd. So viruses do not survive for long periods of time on surfaces, usually die in a matter of minutes to hours, but can survive up to a couple of days. But we think overall that surfaces are not a main driver of transmission, but that's why it's important to remember to wash your hands after you come back from the grocery store, or to wash your hands after you've been touching doorknobs, elevator buttons, things like that. So just remember, wash your hands, don't touch your face until you do so.
And those alcohol hand sanitizers, do they work, Dr. Brewer?
They do if the percentage of alcohol is above 60%. So you want to look for a hand sanitizer that has at least 60% alcohol and avoid the hand sanitizers that have methanol in them. So you want to get an ethanol-based hand sanitizer.
60% alcohol content. Thank you so much, Dr. Brewer. We're going to go to Dr. Willis in Marin County. He's the public health officer. We're taking your questions and comments right now. senator.mcguire@senate.ca.gov. Dr. Willis, this comes in from Karen. What was learned from the comprehensive testing of the town of Bolinas? The entire town of Bolinas got tested, at least the vast majority of residents. What was learned from that? 60 seconds, Dr. Willis.
Yeah, well, we did 1,800 tests over a period of 3 days. I think one thing that was learned is that it's possible to do an operation like that. That was kind of remarkable. I was skeptical when I first heard that was their plan, but they were able to actually get almost every single person in that town through that testing operation. So there was obviously a good demonstration of testing capacity there, and community, will and cohesion. We also learned that there had been essentially no infection, no transmission of the virus in that community up to that point. There were no cases that were detected at that time. That was early. This was going back almost 2 months now. And I think showed the effectiveness of the initial shelter in place that locked down the Bay Area pretty effectively preceding that. Unfortunately, now we're starting to see, as they're seeing across the state, increased cases across our region, including in Bolinas.
Thank you so much. This next question is for Dr. Willis, and we're going to go to Dr. Mays in the County of Sonoma. But first, second question for Dr. Willis, Public Health Officer, County of Marin. This is coming in from Stephen. Could Dr. Willis give an update on steps Marin has taken to protect all homeless folks from COVID-19, including getting them housed? Dr. Willis.
Yeah, so we're one of the key strategies right off the bat was to make sure that people who, as we went into the shelter in place, who could not shelter in place because they had no home, had to have a place to stay. And so we have established relationship with several hotels where we are housing homeless people, regardless of their COVID-19 status, simply to protect them. And that is an ongoing effort. Obviously, now when we have people who are in the hospital who have been diagnosed with COVID-19 and don't have a home to go to, they're also offered housing in hotels.
Thank you so much. Let's go to Dr. Mays. Dr. Mays is the Public Health Officer in the County of Sonoma. This next question comes in from Penny. Dr. Mays, when travel opens again, is there anywhere in Sonoma County to pay for a COVID test with a 72-hour turnaround time? Dr. Mays.
Well, that is a really great question, and I think it's getting to the heart of the matter that testing has been delayed. In other words, the results have been delayed. So even OptumServe, the state-funded sites for testing, now have delays of getting an appointment maybe a week and then getting the result maybe another week and a half. At this time, there are some clinics that might be contracting with the labs that have been put out from the state that might have shorter turnaround times. But this is kind of a delay that we're seeing throughout the system, the county, the state, maybe even nationwide. So at this time, we're prioritizing people who need to be tested, the healthcare workers, first responders, other priority situations like outbreaks. Through the public health lab, we have a turnaround time of 48 to 72 hours. But I don't know of any place you can pay for a test and get a turnaround time of 72 hours.
That's Dr. Mays, Public Health Officer, County of Sonoma. And this is an issue that the state is really focusing on, is how do we hold our testing vendors like OptumServe accountable for expedited times as far as getting folks in to get tested. And we need to continue to expand lab space to be able to work all those tests that are coming in. But the challenge is, Dr. Mays, please push back on me, but we're seeing this across the state and across the West. Labs are full of tests that are coming back because so many folks are in need of a test. Would that be one of the fair challenges to talk about?
I think so. In Sonoma County, luckily, those people who are prioritized for testing that are contacts to cases or have had exposure, or, the priority healthcare workers, first responders, are getting tests with good turnaround times. But I think we're seeing a lot of people in the community who are also seeking testing. And that's what we want to happen, to have more testing. But now we have delays due to the backlog of tests in these labs and lack of testing supplies, things like that. So it is a systemic problem, as you pointed out, Senator McGuire.
Thank you so much, Dr. Mays from the County of Sonoma. We're going to go to Dr. Brewer. Dr. Brewer, we're getting 24 questions about masks. So let's get to the heart of these questions. This one is coming in from Pamela. There are several asking very similar questions to Pamela. Pamela says, I've been making some masks for myself and friends, but feel I don't have enough guidance as far as the best type of fabric masks to make. She's heard about conflicting info about the best design and fabric. So, Dr. Brewer, set us straight. What type of fabric should folks use, and what are the best masks that folks can use to be able to prevent the spread of the coronavirus?
So, Pamela, pretty much anything you use is better than nothing. In terms of the hierarchy, the best masks are what are called N95 respirators, but in general, we reserve those for our healthcare workers, particularly when they're involved in taking care of COVID-19 patients where there might be doing things that will release virus into the air around the patients while you're taking care of them. So those are our best, and they work at a level of about 99.9% efficacy. The next level are the surgical masks that you tend to see healthcare workers wearing, for example, in an operating room. They have an efficacy of about 98%. And the regular cloth mask that you can buy in a store or a pharmacy actually works somewhere between 94 and 96%. So pretty much any facial covering will get you well on the way to both preventing you from spreading the virus to others if you're infected and providing some protection for you from getting the infection.
All right, we're getting, Dr. Brewer, let's stick with masks. We're getting a lot of emails in tonight saying masks are unhealthy to wear. They breathe in their own CO2. Teresa has said that vented masks are unsafe because of the outflow of air. So let's talk about what's safe about a mask. Number one, is a mask safe to wear? And then number two, talk about a vented mask, and are there challenges with those?
So masks are safe as long as you don't have underlying respiratory problems, so you don't have trouble breathing, particularly any kind of anatomical abnormality. So if you have severe lung disease or you have some kind of problem with your nose or mouth, then you should not be wearing a mask, or if you're a child under the age of 2. Or if you can't remove your mask, you should not wear a mask. But otherwise, masks are safe. There's no concern about CO2 buildup. I have worn N95 respirators for hours on end taking care of tuberculosis patients. No problems with CO2 buildup. No problem with oxygenation. There are YouTube videos showing doctors wearing masks and riding bicycles, and their oxygen saturation levels are totally normal. So really, unless you have underlying respiratory problems or you're not able to remove a mask, there's no safety risk to wearing a mask. And I'm sorry, I forgot the second part of the question, Senator.
Oh, you answered about the vents. Is it safe to be able to wear? Yes, yeah.
Yeah, so in general, we do not recommend vented masks because of the concern that it's more likely for respiratory droplets to get in, but a vented mask is still better than no mask at all.
That's Dr. Brewer.
Can I offer?
Please, Dr. Willis.
Senator McGuire, so we did an analysis of the vented masks here, and basically, the idea is that we should avoid vented masks because they sort of defeat the purpose, and that they're intended to actually allow exhaled air to go through the vent, and so obviously we're wearing masks more to protect others. I wear my mask to protect you. You wear your mask to protect me, and a vented mask where it allows exhaled air out into the environment defeats the purpose.
Thank you so much. That's Dr. Willis, the Public Health Officer in Marin County. And let's stick with Dr. Willis. This next question comes from Riley. Riley asks, Dr. Willis, is the outbreak at San Quentin at all responsible for the resurgence in Marin?
No, we're not seeing the correlation between the cases in San Quentin and the cases across the county. They are independent. They are both obviously very concerning, and with over 2,000 cases both in San Quentin and in our community. But it's obviously an isolated environment, a sequestered environment, and so we've been careful to look at the data separately as well, so that we're able to determine what's happening within our community, despite that overwhelming surge in cases that happened in that particular setting.
All right, that's Dr. Willis, Public Health Officer in the County of Marin. We are so appreciative of your questions. Keep them coming. We are going to hit as many possible. We're doing a lightning round right now. senator.mcguire@senate.ca.gov. This is our coronavirus town hall with a special emphasis on Marin and Sonoma counties. All right, Dr. Willis, we're getting a lot of questions for you about masks. So let's talk about masks outdoors. Hank writes in, Hank's from San Rafael. I would like to see addressed of enforcing wearing masks outdoors. Marin has just seen a huge spike in cases and deaths. I walk along a public trail every day for exercise and see about 15% of the people without masks. True social distancing is not possible on the path since it's not wide enough, and also not everyone does their best to stay distant. All right, Dr. Willis, talk to us about wearing masks while exercising in Marin County, and should people be wearing their mask outdoors?
Yeah, so a mask is something that you wear to protect people around you, just because, we know that people may not have symptoms, and a mask is, as Dr. Brewer mentioned, highly effective at preventing spread. It's also, to be infected by someone else, you need to be within a certain distance, generally about 6 feet, and indoors is much worse. So, the CDC does not require or recommend necessarily that an individual out alone in nature, jogging or exercising, needs to wear a mask during that setting. We have actually, make sure that people who, when they are out in parks exercising, have a mask with them, and they would don that mask if and when they encounter someone else. And that seems to be the practice that seems to be the most sort of safe and neighborly practice, which is to carry a mask with you, and put that mask over your face, your nose and mouth when you are encountering another person on a trail within 6 feet, as a matter of public health and a matter of courtesy. But it is not currently an order that an individual outdoors, as soon as they leave the house, don a mask.
Do you believe eventually, depending on cases, it may become an order?
It might become an order, yes. I mean, if we're really not able to get that adherence through what we see as voluntary compliance based on understanding of the principles, we would have to elevate it from a recommendation to an order. Mind you, we do have a mask order for anyone who's indoors in any shared space, and anyone who is outdoors in any common space where there's others around them. For example, walking down the street in town, you must have a mask on, and there's new enforcement around that, and it's a citation of up to $500 to not be wearing a mask. So this particular question was in that unique setting of people who are out in nature.
Thank you so much. That's Dr. Willis, Public Health Officer from the County of Marin. Let's start the question with Dr. Mays about wearing of masks outdoors. Do you believe eventually Sonoma County will go to a full order mandating mask wearing outdoors? Dr. Mays.
Well, it really depends on how much the community actually does adhere to the current order, which basically is very similar to Marin, states that you need to wear a mask or facial covering if you can't socially or physically distance 6 feet from people who are not non-household members. Now, if everybody were to do that, I'm not sure we would need to go there, but certainly we've seen an increase in cases and increasing transmission. I could see that we might have to go to that kind of an order.
That's Dr. Mays. She's the Public Health Officer in the County of Sonoma. We're going to stay with Dr. Mays, and we're going to also ask Dr. Willis to jump in. Then we have a few questions for Dr. Brewer from UCLA Medicine. Dr. Mays, let's talk about fire season. Unfortunately, fire season is here. Karen writes in. We also have questions from Melody, Danielle, along with Mark, about how are the counties, and we'll read Karen since it's more generic and encompassing, how are the counties of Sonoma Marin planning for potential fire evacuation shelters that allow for sufficient physical distancing if large numbers of people are displaced during this wildfire season? Let's start with Dr. Mays from Sonoma County, then we'll travel south to Dr. Willis in Marin County. Dr. Mays.
Yeah, thank you so much. That is actually an excellent question. The last thing we need is a disaster on top of a pandemic. However, we are planning for this. We've actually held several town halls for different districts in Sonoma County addressing this very issue. So we have a disaster plan that's being reworked, taking into account COVID. To the extent that we can, we need to ensure that people are not only able to evacuate safely and go to shelters safely, but also to prevent the spread of COVID to also be able to adhere to all the mitigation measures we put forth. So we're working on that. Having said that, I think saving lives is the most important things here, and evacuating people in the sense when there's a disaster is the most important priority, and we will work very hard to ensure people are wearing their masks, which are good for both smoke inhalation injury as well as COVID, and social and physical distancing.
Thank you so much. Let's go to Dr. Willis. Fire evacuations and physical social distancing. Dr. Willis, Marin County.
Yeah, I mean, I see this as a problem of space primarily. We've had shelters established, and they're based on a certain configuration that is not a COVID informed configuration. 3 feet between cots isn't going to work, and so we're having to find additional locations for shelters. We have the Fireman's Fund building in Novato is being considered. There's the Civic Center. We really need just larger spaces to have physically distanced sheltering. And fortunately, we do have resources, gyms, high schools, churches. There's an abundance of possibilities around the county that would allow us to have a physically distanced shelter environment.
That's Dr. Willis. He's the public health officer in the county of Marin. We're taking your questions and comments tonight. Senator.McGuire at senate.ca.gov. Let's go to Dr. Brewer. Dr. Brewer is an infectious disease physician at UCLA. This next question, Dr. Brewer, is about antibody testing. There's been a lot of discussion about antibody testing here in the United States. Lori asks, how accurate, sensitive, and specific are the antibody tests? Is it worth getting one, she asked.
So Lori, it depends on who's doing the test, but a reputable lab, they're very accurate in the order of sensitivity of about 98% and a specificity of almost 100%. So sensitivity is the ability of a test to say yes when you have disease, and specificity is the ability of a test to say no when you don't have disease. So done well, they're very accurate. One of the problems with the antibody tests are there are a lot of them out there. Some are less accurate than others. The test is not helpful for finding someone with acute infection. So we do not use antibody tests to diagnose COVID-19. Where they really come into play is to help Dr. Willis, Dr. Mays, and our public health colleagues get a picture of how is COVID-19 spreading in the community. And so these serology tests are really primarily based right now for helping understand the public health response and the spread of the epidemic. If you're concerned that you might have SARS-CoV-2, then you actually need to get one of the PCR or antigen tests, not an antibody test.
That's Dr. Brewer, great infectious disease doc from UCLA Medicine. Dr. Brewer, 2 more questions coming in. This next one is from Cheryl. Cheryl tested positive for the coronavirus. She wants to know if she can get it again.
So, Cheryl, a terrific question. Right now, we're not entirely sure. What we do know is that particularly people who have severe disease do generate antibodies, and the antibodies that people make are what are called neutralizing antibodies, which means they should protect against reinfection. But, for example, about 2 weeks ago, there were data published out of UCLA to show that people with mild infection, their antibody levels actually fell very quickly over the course of several weeks to months. And so we don't yet know if everybody will be protected from reinfection. That's an important question we need to continue to look at.
Thank you so much, Dr. Brewer. Dr. Brewer, this next question, it's pretty funny. It's coming in from Lori and Dan. Lori's sister is getting married in Georgia. Dan, I take it her partner or husband doesn't want to go because he says it's not safe to get on an airplane. Can you settle the argument? Is it safe to get on an airplane and go cross-country, let alone go into Los Angeles?
So Lori and Dan, there's any risk with travel, and the question is the reason for the travel important enough to take the risk? And I can't answer that. I don't know how close you are to your sister. But what I can tell you is there are things you can do to minimize your risk. So one is try to travel at a time when fewer people are traveling. Second, look for airlines that do not fill the planes to capacity, that leave open seats in between. Third, make sure that you travel with a face mask. Bring some hand sanitizer and use your hand sanitizer before you get on the plane and after you get off the plane. So if you do decide you need to travel, there are things you can do to lower your risk.
Dr. Brewer, personally, would you get on a plane at this point with the coronavirus pandemic?
Well, I would probably not get on a plane unless I absolutely had to. So I've actually canceled probably about 7 or 8 trips that I was supposed to do primarily for work since the pandemic started.
Straight talk from Dr. Brewer, UCLA Medicine. We're now going to go back to Dr. Mays. Dr. Mays, she is the public health officer for the County of Sonoma. This next question is all about schools, coming in from Jed. Jed asks, what is the current status on the likelihood of waivers in Sonoma County for elementary schools? So right now, all schools in Sonoma County and Marin County are doing distance learning because they're on the state watch list. So let's get into schools, Dr. Mays. Talk to us about waivers and why are we on the state watch list?
Yeah, thanks so much for that question. Really important for all the parents out there and the kids. So we're on the state's monitoring list or watch list because we've sort of exceeded some of the thresholds that are of concern to the state. For example, we have a case rate of greater than 100 cases per 100,000 population over the past 14 days. We've had an increase in hospitalizations of greater than 10% in the last 3 days, and our ICU bed availability is less than 20% for our regularly staffed ICU beds. So we ended up on the monitoring list, which means that we can't open for in-person education for schools throughout, whether it be public or private. However, sensing the need for younger children in the K to 6 grade age group to go back to school for socializing, also for, of course, parents and being able to work, that sort of thing, and to decrease the risk of that age group potentially having serious consequences of COVID, the state has offered a program by which different elementary schools, that would be K through 6, can apply for a waiver. They have to fill out a very extensive application that includes a plan for opening and how they would maintain social distancing and facial coverings for the kids that are required to have facial coverings or that are recommended to have facial coverings. And then the health officer in each county, in consultation with the state, would look at each application and either approve or not approve it. So that process right now is ongoing. And I'm happy to answer more specific questions about that, but it'll really be about specific schools and their plans and the numbers of kids, the number of classrooms, how they'll be able to meet all the mitigation measures.
So we're going to go to Dr. Willis to talk about Marin County schools in just a moment, but let's stick with this topic. Jeremy is asking you, Dr. Mays, how soon do you think Sonoma County will be off that state watch list?
You know, Jeremy, this is really difficult to predict. Right now, our numbers have been pretty much steady. We've been having a lot of cases. We've been having somewhere around 70 cases a day. And I know that many people are aware that there has been issue with the state of California with getting test results through. In other words, that the surveillance system has kind of met a glitch. And so right now, our monitoring and our case data, surveillance data, is a bit on hold while we wait for the state to fix the problem of us being able to get accurate, timely results through the system. So I don't see us coming off the monitoring list soon. I think everybody in the community has to take very seriously all of the orders, mitigation measures, the recommendations, et cetera. So at this point, we're in the wait and watch mode, and we'll see where we go in the next 2 to 3 months.
All right, that's Dr. Mays talking about how long she thinks we may still be on this current watch list from the state. Let's go quickly to Dr. Willis. Dr. Willis, talk about elementary school kids' potential of waivers for in-person learning or a hybrid approach, some in-person, some distance learning. 60 seconds, Dr. Willis. Do you think that's going to happen anytime soon in Marin County?
Yeah, we've been working closely with the Marin County Office of Education on this and share a goal that, we think the healthiest place for kids is in school, and we want to make sure that we can get them into school as safely as possible given the pandemic. Right now, we're not ready for that. Our incidence is too high, and we're going to start the year with distance-based learning. We are in the process of finalizing a local waiver application process. Tomorrow there'll be a conversation with any schools in Marin County who seek to apply for a waiver, so we'll walk them through that process so that those things that Dr. Mace outlined as the elements, they're able to figure that out and apply. So we'll review the applications next week and offer an answer in 2 weeks. But it's going to be at least, I would say, mid-fall before our numbers are close enough to actually open schools without the waiver application based on our trajectory of our incidents right now.
Mid-fall. And Dr. Mays, similar timeline, at least up until mid-fall. Would that be an accurate timing, you think, for Sonoma as well, for schools?
Yes, I would. It's really hard to predict, but mid-fall, even maybe a little later than that. I see a couple of months here of us being where we are right now.
All right, that's Dr. Mays and Dr. Willis. Dr. Willis, Public Health Officer, County Marin. Dr. Mays, County Health Officer for the County of Sonoma. We're going to go back to Dr. Brewer from UCLA Medicine. Again, we're seeing so many questions about masks. So set us straight, Dr. Brewer. Kay has dozens of masks now. She asked, how many times can you re-wear a cloth mask before washing it? And is a cloth mask better than a surgical mask? Dr. Brewer.
So Kay, at least in the laboratory, when they do studies looking at mask efficacy, how well do they work, a surgical mask does seem to be a little better than a cloth mask. So as I said, a cloth mask will give you about 94 to 96% protection, and a surgical mask will be about 98%. So not a big difference between the two. You should wash your cloth mask anytime it gets visibly soiled. So if you cough or sneeze in your mask, it gets dirty, you should definitely wash it. I would wash it at least once a week, but it probably doesn't hurt to wash it every other day or so if it's not soiled. But if it gets soiled or wet, I would go ahead and wash it before I wore it again.
Dr. Brewer, we're sticking with you. We're getting folks who have negative test results from their COVID test. And the question is, can a negative COVID test shorten the quarantine period if the test is done 5 to 7 days after travel? And so once you get the all clear, should you be out and about in society, even if your 14 days isn't up, Dr. Brewer?
So most people who will turn positive after about 4 to 6 days. So that is the typical incubation period, but it can be as long as 14 days. And so if you've been advised to go into quarantine for 14 days for whatever reason, you should not come out of quarantine early without talking to your healthcare provider or a public health official, even with a negative test.
That's Dr. Brewer, UCLA Medicine. We're now going to switch gears, and we're going to talk about going out to eat. Let's talk to Dr. Willis. Dr. Willis, this is coming in from Frank. Frank lives in San Rafael. Frank says the following. In downtown San Rafael on Thursday and Friday nights, the main street, 4th Street, is closed to traffic, and restaurants are serving patrons at tables set up in the street. The patrons mostly do not wear masks, although the servers do wear masks. Dr. Willis, is this activity safe from a public health perspective?
Well, I think this is an example of where we all need to recognize, as Dr. Brewer, I think, responded to the question about travel, is where do you personally make a decision in terms of your own risk? The state is allowing counties, even that are on the monitoring list, to have outdoor dining, and that's based on the fact that outdoors is less risky than indoors. There's more opportunity for dispersion of the virus, and if people are covering their face and maintaining physical distance, we're at lower risk. The fact is that the order currently requires that people who are sitting together at a table in outdoor dining need to be part of the same household unit. So, I would say that if you're concerned about your own well-being, and especially if you're in a risk group who might be, at higher risk for a bad outcome if you were to become infected, if you're older, if you have a chronic condition, these are settings to consider avoiding. And then, of course, when people are engaging in those activities and being out dining, we want to make sure that they're covering their face when they're not actually eating. There's been some effort to try and actually ask people to recover their face if they're not actually drinking or eating, even between bites, to try and limit the risk of transmission. So these are examples of practical and common sense modifications we need to take to allow us to continue to do things that we value and help stimulate the economy while maintaining safety.
So, Dr. Willis, let's stick with restaurants. We're going to start with Dr. Willis, and we're going to go to Dr. Brewer. So, Dr. Willis, your opinion, can an individual get COVID by putting the silverware into my mouth if the server is COVID positive and droplets fell on my plate or my silverware? Dr. Willis, what say you?
Yeah, let me start with Dr. Brewer, and then I could see if I agree.
Dr. Brewer.
So the answer is yes, it is theoretically possible, right? So if a virus contaminated a surface, like a metal surface, and we know it can survive on metal surfaces for periods of time, and then that metal surface got into your mucous membranes, like your mouth, yes, transmission could happen. But in general, that's unlikely. And hopefully that server is wearing his or her mask, so they're reducing the risk of producing droplets by 94 to 96%, depending on the type of mask that they're wearing. They're washing their hands, and the silverware has been cleaned, all of which will reduce your risk of getting disease. But it is theoretically possible that, yes, you could get COVID-19 from putting a contaminated surface in your mouth.
All right. Dr. Willis, are you okay if we move on? Thank you so much, Dr. Brewer, UCLA Medicine. We have another question for Dr. Willis, and then we'd like to go to Dr. Mays. Are you okay if we move on to our next question, Dr. Willis?
Absolutely.
All right, this is coming in from Gina. Gina says, Dr. Willis mentioned that a top driver for transmission in Marin County was social gatherings, but he gave an example of indoor parties. Is that true of small outdoor gatherings as well, not involving social bubbles? So are you seeing the spread in Marin County from outdoor gatherings as well, or do you believe it's just indoor gatherings?
Well, this is part of the limitation of our methods for determining where transmission is happening. We do a contact investigation. We reach out, we interview every case, and ask them what their potential exposure was. We are finding that it's more frequently, when it's gathering related, it's more frequently an indoor gathering. And that makes sense because the transmission is increased indoors. I mean, that's one of the general principles of all of our shelter-in-place orders has been moving things outdoors. We've done that with hair salons, personal services, restaurants. So the risk is lower outdoors. We presume that there is transmission occurring in outdoor gatherings as well, especially if people are not physically distancing and covering their faces. But we haven't seen as much evidence of that in our outbreak investigations.
Thank you so much. That's Dr. Willis. Dr. Willis is the public health officer in Marin County. We're now going to go north and talk to Dr. Mays. Dr. Mays, this is coming in from Tony. Tony asks, what are the consequences for people who do not wear face masks or adhere to the mandates on gatherings in Sonoma County? Dr. Mays.
Well, I think that, we are looking at issuing citations for people who are clearly, not in adherence with the health officer's order. Right now, our order states that we could have gatherings of up to 12 people outdoors that are non-household members. So that would be sort of barbecues or having neighbors or friends. We're re-looking at that number because we have seen transmission, whether it's indoors or outdoors with gatherings. So I think like Marin, Napa, and some other counties, we're definitely looking to our Board of Supervisors to have a little more enforcement of those orders.
Thank you so much, Dr. Mays. Dr. Mays, Public Health Officer, County of Sonoma. We have just a few minutes left. We're going to try to squeeze in a few more questions, and we are so grateful that you've been with us. Senator.McGuire@senate.ca.gov is your email to hit up for questions or comments. Let's go back to Dr. Brewer. Dr. Brewer is our resident infectious disease physician from UCLA Medicine. Dr. Brewer, this is coming in from Phil. Phil says he tested positive for the virus, and he wants to know, can he give blood now that he's tested positive for the virus? Dr. Brewer.
So yes, Phil, you can. And in fact, we're trying to get blood from people who have recovered from the virus to get what are called convalescent plasma or sera. So we actually take that blood and we separate out the antibodies, and we use the antibodies that your immune system has generated to fight off the virus to treat patients who may have SARS-CoV-2. So you look look around. Certainly in the Bay Area, there will be hospitals that are offering that service. I don't know specifically about Marin or Sonoma counties.
That's Dick. Thank you so much.
If I can answer that real quick, I could just
Please,
the Red Cross for anyone in Marin County who wants to donate blood, whether or not they've been infected. We're having national shortages in regular blood, and then obviously the plasma for convalescent serum. And both of those can be donated in Marin through the Red Cross, and just go online to Google where you would find that.
No, thank you so much, Dr. Willis, Public Health Officer from the County of Marin. Dr. Brewer, we're getting a lot of questions about asymptomatic cases. So let's just narrow them down. I'll start with our first one. How long, this is coming from Abigail, how long do asymptomatic cases last, and how contagious are they? That's one of two. Go right ahead, Dr. Brewer.
So, Abigail, there was a study done in Taiwan where they looked at over 2,700 individuals who were contacts of 100 known positive cases, and there were 22 examples of secondary transmission. None of them occurred from asymptomatic individuals. That having been said, we know from studies from Germany and the United States and elsewhere where it does happen, but we think that on an individual level, people with symptoms are more infectious than asymptomatic people. The problem is there are so many more asymptomatic individuals with infection that they account for probably about 40 to 45% of the total transmission. So they clearly can transmit, though not as frequently as someone who has symptoms.
So 40 to 40 asymptomatic cases represents about 40 to 45% of the transmission. Robin then goes on to ask, what does the data show about asymptomatic cases? What is the percentage? If you look at a total number of those who have the coronavirus in the United States, how many are asymptomatic?
So, terrific question. We don't know for sure, but we think that actually most people develop symptoms at some point, and what's happening is transmission is occurring in what's called that pre-symptomatic phase. So a person is asymptomatic at the time that they're capable of spreading the SARS-CoV-2 virus, but they do eventually develop at least some symptoms, even if they're minor ones. And we think more than 85% of people will eventually develop some symptoms, though they could be very minor.
We're still 1,000 strong on the line tonight. Thank you all. Marin and Sonoma County, we're going to go to our last three questions of the evening. This last question for Dr. Willis, it comes from Albert. Albert asks Dr. Willis, what is the predominant test being utilized for coronavirus in Marin County, number one, and what is the metric for maintaining Marin on the state watch list? The floor is yours, Dr. Willis.
Yeah, thank you, Albert. So the predominant test is the PCR test. It's a test that is a nasal swab that looks for the presence of the virus itself in your nasal passages. And that's the test that Dr. Brewer outlined is really the dominant test nationally for diagnosing active infection. I'm sorry, what was the second part of the question?
The second part of the question is, what is the metric?
Oh, the metric. Yeah, so our metric is the same. It's statewide. It's established as the monitoring list is any county that has more than 100 cases per 100,000 residents over the past 2 weeks. For Marin, that translates to 19 cases per day. So our goal as a county is to work together to try and reduce our overall case rates to less than 19 cases per day together, and that would get us off of the watch list.
Thank you so much. That's Dr. Willis, the Public Health Officer in the County of Marin. We are so grateful for his hard work. We're now going to go to the final question for Dr. Mays. She's the Public Health Officer in the County of Sonoma. Cindy asks, Dr. Mays, will we continue to have free COVID testing for non-symptomatic patients? We had it and then it went away. What do we know about optimum testing availability?
Well, we still have OptumServe, and there's two sites, both in Petaluma and in Santa Rosa, and it does offer free testing for anybody who wants to be tested. And right now, the contract has been will be extended in all likelihood through September. So I think that will still be available. And then after that, they may have another renegotiated contract to provide the same service. So right now, 560 tests a day are being performed by OptumServe. It might take you a week to get a test, and then it might take an additional week to get the test results back, if not a little longer. So if you're symptomatic, you should go see your doctor. Thank you.
Thank you so much. That's Dr. Mays. She's doing a fantastic job in the County of Sonoma as Public Health Officer. We appreciate you being with us tonight. Let's go to the final two questions for Dr. Brewer. Dr. Brewer, there's been some questions coming in about New York, who has implemented rapid 15-minute tests. How true is that, Dr. Brewer?
So these tests exist. They're FDA approved. And again, there's variability, so there are multiple tests out there, but there are high-quality tests that are capable of giving you an answer within minutes rather than hours or days.
All right. Final question for Dr. Brewer. This is coming in from Vanessa. Vanessa is very worried about flu and COVID overlapping this flu season. How concerned are you that our hospitals will become overwhelmed with virus and flu patients? Dr. Brewer, talk about that and understand that we need to get a flu shot, but where is your concern about this as we move into the winter and fall?
Well, as Dr. Mays and Dr. Willis mentioned, we can overwhelm our hospital capacity just from influenza. So I'm very concerned about the fall and the winter. This past winter, we actually had a pretty bad flu season. We had about 62,000 deaths from influenza estimated by the CDC. And so it can be very difficult to manage both. That's why the flu vaccine is so important. But the other good news is that the steps that you take to protect yourself and your loved ones and your community from COVID-19 will also work to protect you from influenza. So that physical distancing, the hand washing, the staying home when you're sick, and the using of the facial coverings will also help with influenza, just like they'll help for SARS-CoV-2.
Dr. Brewer, thank you so much for joining us. That's Dr. Brewer, infectious disease physician at the Geffen School of Medicine at UCLA. We want to say thank you so much to Dr. Mays. Dr. Mays is the Public Health Officer for the County of Sonoma. And, of course, the hardworking Dr. Willis. Dr. Willis is the Public Health Officer in the County of Marin. We wanted to be able to give you the most accurate, timely information tonight related to the coronavirus. We wanted to provide you with a look ahead when it comes to flu season and, of course, how long it's going to take for a vaccine to be produced and then mass injected there throughout the nation. We are grateful for our medical experts who've been with us tonight and for all of your questions or comments. We want to let you know we'll have a full audio recording, a recap of this evening's town hall up on our website here by tomorrow evening. We'll also distribute it through Dr. Mays and the Public Health Office with the County of Sonoma and Dr. Willis with the Public Health Office with the County of Marin. Until next time, thank you so much for joining us. Stay safe, and North Bay, stay strong.